Assessing your hip flexion is actually very simple. You just need a few things. First is a stable platform that you can lie down on. This could be a treatment table like this. This could be a plyo box at your gym or a weight bench, but pretty much anything that will get your feet off of the ground when you sit on it upright like this. Okay? The next thing is something stable to put your camera or your phone on or against so it can film you close to this level. So it doesn't need to be super high, it doesn't need to be all the way to the ground, but about the same level that you are sitting at. To start the assessment, all you're going to do is turn so the camera has a good side view of you. You're going to sit at the very edge of the platform that you have, and then you're just going to lay back. Now, when I let both my legs fall down like this, my back arches up off of the table. So what I'm going to do is bring my knees towards my chest until the back just flattens. It doesn't need to be rounded, and it doesn't need to be firm pressure, but just a little bit of pressure from your low back onto the table or bench below. Then the leg closest to the camera is going to be the one that we're going to assess. So you hang on to this one knee, the far knee, and then let the close leg fall. And then I want you to just relax as much as you can. We're looking for a couple of things here. First, that you're relaxed. Second is the position of your leg. There's generally passing and failing, okay? The first thing that we're gonna look at is gonna be the height of the knee relative to the hip. So kind of guesstimate the middle of this area. That's where the hip joint is, give or take. And we wanna see the knee below it without your back arching up, hence holding onto this knee. So the knee needs to be below the hip. The next thing that we're going to look for is the angle that your shin makes. If your knee is slightly straight and your shin is at an angle that's not perpendicular to the floor, that means that one of the muscles, one of your quads, is especially tight. So we're looking for knee to be below the hip and shin to be vertical for passing. Now I'm squeezing to get down there because when I rest, relax, I obviously don't quite meet this test. So I fail. If you're not sure whether you pass or fail, mark unsure on the grading, the grade sheet. And then, of course, you're more than welcome to reach out to us at any point.